Hi, this is Dr. Daljeet Kaur. I'm a senior consultant psychiatrist here in Continental Hospital, Hyderabad. Today we're going to talk a little bit about autism spectrum disorder, its diagnosis, its symptoms, and how you should seek help for further management. Autism spectrum disorder is a neurological and developmental disorder, which means it affects the way a person or a child behaves, learns, and presents in the community. They can have their own deficits. The main symptomatology would be covering 3 to 4 areas. It would be deficits in social interaction and communication. There can either be a speech delay or a child learns to speak at the right time, but there can be regression of speech. A child can have stereotypical or repetitive movements, things like, flapping their hands or banging their head, something that is very visible, and it can change from one, behavior to another over the course of time. A child can be sensitive to noises or bright light, so a lot of sensory work needs to be done. So if you see any of these symptoms in a child from 18 months onwards up to 3 years, that is when the presentation starts. I think the parents should start getting worried and concerned and take their child for an assessment. What normally happens is, in our Indian setup, we are okay sometimes. Our threshold is different when children do not speak, and we keep waiting for them for 3 years, 4 years, saying, oh, the father also spoke when he was 5 years old. I think we have to change that mentality. We have to seek professional help very soon, by 2 years itself. Now, once we are suspecting a diagnosis of autism, how do you proceed? What kind of help do you take? Well, you can either go to your developmental pediatrician or your normal family pediatrician. You can go to a psychologist, you can go to a psychiatrist, and these are the people that will help you in terms of developmental screening and to go ahead with a diagnosis. Once a diagnosis is made, which will take its own time, it's a process, so you would be called 2 to 3 times. And then, because it is a spectrum and every child's needs are different, the treatment plan also varies. So the kind of support or treatment we would be looking at is speech therapy, if speech is a problem, and obviously communication needs to be addressed here. Occupational therapy is very important because it helps you with the sensory part, the sensory regulation. You might see some children clinging on to their parents or not wanting to touch particular things, not wanting to eat with their hands. They're very sensitive to specific textures, and also all that work can be done through occupational therapy. A psychologist can help you with behavior therapy, which could include, applied behavior analysis, which is a standard treatment for people with autism. There are also different techniques that can be used. CBT can be used, mindfulness, relaxation techniques. So overall, what we need to understand that a child with autism can behave a little bit different compared to others in play school, in school, and if we pick up these symptoms early on, we pick up these developmental delays and early signs of autism early on, a lot of work can be done. You can make them really highly functioning, they can go to mainstream school, they can fit in with other children. So friends, the main key here is early intervention. So as early as 18 months when the work can start. So please do not delay any symptoms that suspect you or raise a suspicion that this could be going towards autism spectrum or something else, even if your child is hyperactive, because that can sometimes be a presentation even in children with autism. Please seek professional help. Here at Continental Hospital, we have a team. We have a very good department of psychiatry where we have psychiatrists, we have psychologists, and we work with the pediatricians and developmental pediatricians to give you a comprehensive care. So good luck and take care, and please see us soon.